So good morning, everyone. Today I am going to start with the revision for the civics chapter, that is role of government in health. So गवर्नमेंट का रोल हेल्थ में क्या है? सबसे पहले मैंने आपको क्वेश्चन दिया था, व्हाट इज हेल्थ? कैन एनीवन टेल मी व्हाट इज हेल्थ?
Ma'am, health is the ability to
What is health? Yes.
health is the ability to remain cut from the illness and free from the illness.
Okay, health doesn't means that only we are talking about the diseases or the problems related to the body, related to the human body. Health also take care of all the things that a person should be free from the illness, from the body as well as from the surrounding, natural environment जो है, that should also be included as a part of health. If you have continuous voice surrounding your area, then whether you will feel comfortable, can you concentrate on study? No, you can't concentrate. It means health is also considering the aspect of natural surrounding. So health means our ability to remain free from illness or injuries. It doesn't mean that illness or injuries only on the physically part. It also include the surroundings. It also include the other aspects like clean availability of clean water drinking, availability of clean environment and sanitation जो है, that should be there. Can you write this answer in your notebook right now? What do you mean by health? Can you write? Hurry up, write it down and send it on me on my WhatsApp number. Jaldi se. Hurry up. So health means our ability to remain free from the illness or diseases. It also include all the other aspects like safe and clean drinking water. Number 2, pollution-free environment. Number 3, adequate amount of nutrient or good quality of food. So all these are included in the term of health. Write it down and send it to me on my number. Hurry up. I just want to check now. So I'm going to tell you about how the medical facilities are there in India. India is having largest number of medical colleges. Number 2, it is having largest producers of doctor in the world. It is having the capacity. India's medical college are having the capacity to produce maximum number of doctors. Say 15,000 doctors every year. Write down this point. 15,000 doctors every year. Then we have in 2000 colleges, in 2000 year mein, in 2000 the number of medical colleges were कितना था?
18,218.
Yes, 18 to 18. ऐसे याद करना है. Fine. So this will be your next point, and then next आ जाता है, India is having largest number of medical tourists because cheap and good quality of medical treatment is available in India. ठीक है. उसके बाद India is having 4th largest producer of the medicine in the world. 4th largest producer of medicine in the world, and also larger exporter of the medicine in the world. So question is, write about the health care facilities available in India. Question is, write about the health care facilities. Now I'm going to tell you questions. Write about the health care facilities in India करो, in India. हाँ जी. Number 1, number 2, number 3, number 4, number 5. Can you write? Will you be able to write? Write down fast and send it to me. So now I am going to start with the next, that is full form of PHC, CHC and आपने क्या बोला था? RMP. ठीक है? इन तीनों की full forms क्या आएगा? बताइए. Anyone?
Public Health Center.
Public health center.
Primary health center. Then is community
Community
Health Center.
health center. Then is registered.
Registered medical practitioners.
हाँ, registered medical practitioner. Fine. Is it okay? So write down these three. It should be with you. Okay, I am going to read Yuvam Ohri's answer. Yuvam Ohri. India has largest number of medical colleges in the world and is among the largest producer. Okay, सुनाएगा मुझे कौन? आयुष. आयुष, सुनाइए मुझे जरा आंसर. ये सबको लर्न हो गया कि देख के लिख रहे हो?
मैम हमने ये फुल फॉर्म्स भी लिखकर भेजनी है.
फुल फॉर्म लिख के अपने पास रखो, नेक्स्ट क्वेश्चन के साथ इकट्ठे भेजोगे. हरी अप. नाउ स्टॉप सेंडिंग इट टू मी. रमनीक आपका आ गया, मैं देखती हूँ, चेक करती हूँ बेटा. रमनीक, I received your also. So now come to the next. What are the demerits in India? और यहाँ पे हम next करते हैं. What are the public health services and private health services? हाँ जी. Public health services क्या होती हैं? What are public health services and private health services? Have you noted this?
Yes, ma'am.
Okay, fine. Now come to the healthcare facilities which are being insured by the government, or healthcare facilities which are being insured or given by the this you can say private sector. So here we will be going to compare public health center and next is private health center. Fine. Now public health center. अब हमें health की definition आती है. Health facilities are the facilities which in which it means a human become free from the illness, not only the diseases but the other aspects also, like they should have clean water, drinking water, safe environment, and you can say pollution free environment. So and good amount of food. Public healthcare facilities are the facilities provided by किसके द्वारा होती है? Government. Okay. And private healthcare facilities are provided by
Private doctors.
private individual and organization. Fine. Their main motive is to, motive क्या होता है इनका? Their main motive is to do welfare of the community as a whole. Here motive क्या होता है इनका? To do or earn profits. Available in both rural and urban area. They are mostly available only in urban area. Any other points? आप बताइए. They ensure health care of all. They ensure health care for all at reasonable price.
Public healthcare centers have nominal charge.
Okay, yes,
Nominal
I had also
charges.
written this in this way. You can see. You can see
Public
here.
health
They ensure
Center,
health care
health
for
care.
all at reasonable price. They are charging nominal prices. They are charging high prices. They are costly. Or charging
Ma'am,
high prices. हाँ जी बेटा.
मैम ये पॉइंट ऐड कर सकते हैं. The public health services need to be changed
Need to.
because
Ma'am,
public healthcare
ma'am,
centers
ma'am,
facilities are not
One
too
by one,
good
one
and
by
they
one.
should be.
ma'am,
Ma'am, public
Public
healthcare
health-
centers should be
हाँ हरनूर बोल.
facilities are not too good and they should.
वो हम उसके डी पैरेट्स में लिखेंगे. अभी हम लोग पैरेट्स लिख रहे हैं कि पब्लिक हेल्थ केयर फैसिलिटीज क्या देता है एंड प्राइवेट हेल्थ केयर फैसिलिटीज क्या देता है. अदरवाइज हम लोग पब्लिक हेल्थ केयर फैसिलिटीज में क्या ड्रॉबैक्स है. दैट नो अवेलेबिलिटी ऑफ डॉक्टर्स वेल ऑन टाइम. ये डीमेरिट्स है. No taking care is being done properly by the that area. मतलब that particular in the public health care. हाँ जी बेटा.
Ma'am, public
One by
healthcare,
one. Listen,
center
वामिका
का-
वामिका बोलो. वामिका बोलो.
मैम पब्लिक हेल्थ केयर सेंटर का 4th पॉइंट क्या है?
फोर्थ पॉइंट क्या है? फोर्थ पॉइंट मैंने लिखा है they ensure health care for all at reasonable prices. Got it?
Excuse me, ma'am.
हाँ जी बोलो बेटा. कौन बोल रहा है ये?
Public health. Ma'am, Yuvam.
Okay, Yuvam.
Ma'am, public health services provide a treatment to all diseases.
Yes. You can add. Now write down this answer and send it to me fast. As we know that healthcare facilities are not available in everywhere. Why? Because the private practitioners जो होते हैं, they try to make their hospitals only in the urban areas and they do not want to open their medical, you can say medical health centers or medical hospitals in the rural area because they will not be able to get more, you can say earn a profit. Second thing, हमारे इंडिया में गरीबी इतनी ज्यादा है जिस कारण all the people cannot afford all the facilities which are available in the private hospitals. As in the public hospital, less number of doctors are available to treat. So हमारे इंडिया में मेडिकल जो है वो काफी एक्सपेंसिव है which is not possible for all the people to afford. हमने डाटा किया था, that was on page number 26 and 27. अपनी बुक का page number 26 and 27, please open that. And in fact, barely 20% of the population can afford all the medicine as they require during and the illness. But the persons who are poor, they are not able to afford that expensive, and 40% of the people who are admitted in the hospital for the same illness or injury have to borrow money. सिर्फ 20% लोग अफोर्ड कर पाते हैं और बाकी नहीं कर पाते हैं. बाकी 40% अगर होते भी हैं, मेडिकल कॉलेजेस में जाते भी हैं मेडिकल ट्रीटमेंट लेने के लिए, उनको अपने एसेट्स बेचने पड़ते हैं. दिस इज द फैक्ट. And poor every illness family cause a great anxiety and disease. Poverty जो है, that is another a reason of illness because their surroundings are not proper good. Healthcare जैसे कि हमने last chapter में कांता के बारे में पढ़ा था. Her environment was not properly there and her daughter was get ill and she was supposed to stand in a line for the whole day. ठीक है। और हकीम शेख का भी हमने पढ़ा था कि he was not being treated in the government hospitals because not availability of the doctors at that time was there. So all these factors are still there, and they don't have safe drinking water, they don't have good quality of meal with them. So all these are the demerits or not inequalities available in India. These are the inequalities available in India. So हमें क्या करना चाहिए? गवर्नमेंट कॉन्स्टिट्यूशन हैज इंश्योर, कॉन्स्टिट्यूशन ने ये इंश्योर किया है कि हमने वेलफेयर फॉर ऑल एंड टू प्रोवाइड हेल्थ केयर फैसिलिटीज टू ऑल। उसके लिए गवर्नमेंट ने स्कूल्स के अंदर 2001 में, आपको पता होगा, तमिलनाडु ने क्या किया था, याद है?
Midday meal scheme.
Yes, midday meal services was being started by the Tamil Nadu state first time in 2001 with the motive of providing at least one time food to the poor children. उनका दूसरा रीजन क्या था? So that children can come to school and get the education and have at least one time proper meal, and they should not fall under the category of poverty and under the bad health condition. Another example जो हमारी बुक में दी हुई है, that is केरला एक्सपीरियंस। केरला ने अपना जो है मैटर जो है वो फ्री किया, गांव के अंदर वाटर, फूड और वुमेन डेवलपमेंट और एजुकेशन के ऊपर इंश्योर किया। एंड कोस्टा रिका, इट वाज अ साउथ अमेरिकन कंट्री जिसने अपनी मिलिट्री के ऊपर पैसा नहीं लगाया, पैसा किसके ऊपर लगाया? अपने लोगों की एजुकेशन के ऊपर, बेसिक डेवलपमेंट के ऊपर, प्रोवाइडिंग सेफ ड्रिंकिंग वाटर एंड सेफ इन्वायरमेंट, so that illness जो है वो हो ही ना। Will you be able to do this chapter properly and revise it properly?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes,
So
ma'am.
tomorrow we will do another chapter.
Yes, ma'am.
ठीक है? Fine?
मैम गूगल
Yes,
फॉर्म नहीं आना।
आ गया था बेटा, मैंने सेंड कर दिया था। Okay, it just